This is Sg2 Perspectives, a conversation with industry experts and Sg2 thought leaders about the biggest trends in healthcare and what we all expect that's going to mean for the future of healthcare delivery.
I think it's going to be a really fun time for strategy leaders in that they will be able to set themselves apart, have a bigger seat at the table, and push their organizations forward. We've seen more progress in the last several months than we've seen in years at many organizations. And to keep that momentum, that's going to be the goal of our strategy leaders. And I think that's really exciting.
Welcome to Sg2 Perspectives. We're your hosts, Trevor Duran and Kelly Richard, back for another great episode. Today, we're going to ask our colleague, Rebecca Limestall, who's the brains behind a lot of Sg2 intelligence, but in this case specifically, leads our annual Executive Summit series, which has just wrapped up. We're going to ask her to give us the highlights from this year's event. Now, for those not familiar, the Exec Summit's an annual series of conferences we host for members, and it provides a forum for us to do what Sg2 does best, which is translate healthcare industry trends into recommended strategic responses for hospitals and health systems. And this year, we delivered the content 100% virtually for the first time ever, of course, due to COVID-19. But the good news for you all is that means there'll be links in the show notes where you can go in and either watch videos or download the slides or get any accompanying materials that we discussed today. So, Rebecca, the theme this year was Tomorrow is Here. And because we developed this content in the fall and winter, somehow in November, you knew when we crafted this theme that this was going to be a transformative year in healthcare and a year like no other. So why is the theme relevant to how health systems are thinking about their futures in this unique COVID-19 environment?
Oh my goodness. It's hard to even think back to that time. So much has changed since last fall. As you mentioned, this event is something that we prepare for all year, every year. It's an annual event. So it showcases the latest and greatest of our research areas that we look to explore. So we start creating that theme first, and that helps us to sketch out the ideas that we need to move forward with the research. Well, fast forward to March, and the U.S. healthcare system changed dramatically. We went back to the drawing board on a lot of our research items to make sure that they would be relevant to our members, and this coming up in July. And of course, we switched to that virtual format. I think the neatest thing about this is the theme that we selected back in November is probably way more relevant now than it even was back then. The idea of tomorrow is here, strategy for the new clinical enterprise, it really is the sense of optimism that we are looking forward to, that we are looking for areas to seize the moment, to move forward, to help our health systems make those better decisions in this new environment that they're in. So while our material and the presentations and the research areas and everything changed that was within the Executive Summit, we actually kept the theme, and I think it worked.
I'd agree. I think it worked as well. And we didn't want the whole conference to be focused just on COVID-19, but given that we're all sitting at home and it's inevitably going to be an undercurrent at the very least and front and center for many, what are some of the key themes that came up related to COVID-19 across multiple topics and forums in the Exec Summit?
So first, we're so proud of what our health systems have achieved in the innovations, the progress that they've made in just the last 4 months. The feats of the front lines is inspiring. We actually had a physician panel made up of physician leaders within Sg2 and Vizient, so our team members, who talked about the clinical workforce and the awesome feats that they have gone through, and how to work on things like resiliency and looking for opportunities for better partnerships, and how to help support those physicians and nursing leaders within your organization. But going back to some of the ideas of what's changed and how our health systems have embraced that, I loved a quote by one of our member panelists, Bill Robertson, President and CEO of Multicare in Washington State. His quote was, "The crisis accelerated inevitable change." I love that. It's so true. And it's noted in several of the trends that we pointed to throughout the day. Rapid adoption of virtual health, accelerations in outpatient shift, adoption of rapid cycle planning, care redesign, and the focus on physician alignment. I also think it's worthwhile to point out some areas that have forever changed, particularly in the State of the State presentation, but it was carried throughout the day. I would have never thought that as a strategy person, I'd be talking about supply chain resiliency. But yes, supply chain being part of strategy and being a key component is absolutely something that has forever changed. A health system's role in public health, we're seeing that ecosystem evolve. We're seeing the need for partnerships continue to evolve. And then the rapid adoption of virtual health, we saw health systems jump from 0 to 100% of virtual capabilities in very little amount of time. In fact, one of our leaders on the member panel from Lake Health said that he had 0 primary care virtual health visits on March 1st. Within 2 weeks, they created a platform, adopted the platform, and 95% of their primary care visits were delivered in a virtual fashion. That's the type of transformative, rapid change that we saw. And now, as we start moving forward and the theme of tomorrow is here, we're asking our health systems to embrace that change, to move forward, to see how they can continue to adapt and adopt new changes in their health system.
Yeah, and I think that virtual health example is a great segue into the next thing I wanted to ask you about, which is just what some of those key drivers are behind the brand new impact of change forecast that SG2 puts out every year. We have health systems that are constantly trying to predict the future, more or less, or at least scenario plan. And we had some major changes that came about in a pretty fast time frame as a result. Can you talk through some of those?
Sure. So it's tough to describe our impact of change forecast, which is really a look to the future of care utilization without visuals, but I'm going to try. So essentially, we anticipate and have seen a huge dip in a short-term utilization and a longer sense of recovery timeframe. There's a number of things that we have modeled into our forecast. And for those of you who aren't familiar, we use a disease-based forecast. So it allows us to look at both the inpatient and outpatient side to project utilization on the basis of major trends that we're seeing. So things like policy, consumerism, understanding the impact of the system of care and the care continuum, as well as looking at things like epidemiology. All that goes into our model at a disease basis. Well, we modeled the impact of not just the COVID-19 shutdowns that happened earlier this year and things like elective surgeries, but also adjacent factors and some of those areas that have forever changed. So we mentioned virtual health already, but also things like weakened consumer confidence, coverage erosion that we're seeing and anticipating even further with the evolution of the economy as well. And we see a continued decline in the economy. Accelerated site of care shifts, and then also the long-term disease burden. And this is something that our experts talk a lot about, is the long-term disease burdens, not just in those areas that are impacted by COVID directly and those that have been infected, but also things that have been not diagnosed or not treated in the short term and how that might be exacerbated in the long term. It does look different disease by disease, though. And so this is something that our service line leaders talked a lot about within the panel with the service lines. So, for example, the rapid adoption has happened across all service lines for virtual health. But I think behavioral health has been one of the most interesting ones because it's kept a lot of these patients out of the ED. And this has been a goal of the system of care for behavioral health for a while, and allowing us to be able to do that in a more patient-centered way is a phenomenal thing that we've been able to advance more quickly across the U.S. Another example is the adoption of hypofractionation within cancer services. So the idea of less radiation treatments by being able to have a more targeted radiation dosage. By doing that and adopting those protocols that have been in place in other countries and have been slowly been adopted in the U.S., we have actually seen care redesign accelerate. And that's, in effect, kept some of those immunocompromised patients out of the health system a little bit more so that they can keep them safe. So those are some things to consider, service line to service line, disease by disease, but it also varies market to market. I would say this is something that is even more true this year as we see this shifts in surges across the different markets in the US happening at different times, and the impact and duration looking different as well. So we do recognize that, and we work with organizations to help them localize those factors that are driving their utilization numbers within their organization. And that's in our forecast, but also in some of the scenarios that we help people build as well.
Yeah. And just something that really struck me when we were listening to all of the talks yesterday, specifically Maddie McDowell talking a little bit about how we can't separate the virus from the economy. And I think that that's certainly true. And sort of we start there in a lot of the tools and a lot of the content that we produce. Trevor and I put together a payer mix scenario planning tool. And it seems like that's sort of the first level that you go to on a localized level, is really to try to understand the different scenarios and how they interact with the economy, and then how that should impact care delivery within your market.
And Kelly, you two know this even better than I do, but one of the areas that is most interesting with the payer mix calculations is the concentration of industry in a market. So which industries are most vulnerable to the current downturn of the economy, and how concentrated is that in the market? And I think that's something that many organizations haven't thought about. It's different than past recessions that we've had to deal with.
Yeah, absolutely. That was a key part of the payer mix shift planning we did. Rebecca, I'm going to go back to a concept you mentioned, and you really can't do an SG2 presentation without mentioning the system of care. And of course, you checked that box already today. It's such a foundational SG2 concept and a framework for just how we work with members. It's 10 plus years old. We were talking before this episode that Rebecca was there when it was developed. I was an SG2 member when it was developed. So healthcare looks different today than it did when we created the system of care, though. So we're forecasting the physical footprint of health systems is poised to keep changing and probably change rapidly. And that means we're rethinking the system of care concept. So how are we going to think about the system of care differently in the future?
Yeah, so I think it's worth a brief step back here to say, okay, what were we trying to achieve with the system of care? And for those of you who aren't familiar, the system of care it's a strategic and clinical look at healthcare where we understand that healthcare delivery happens so much more than at the locus point of the hospitals. And at the time of development, it was very much, hey, hospitals, we've got to look outside our walls, whether you own the pieces or not. You're increasingly responsible for the entire care continuum. Well, that's still true. And we still use the system of care on such a regular basis to help organizations think about gap analyses, think about opportunities across the care continuum, channel management, total cost of care. All those big strategic decisions need that care continuum approach. But as we look at 2020 and beyond, the strategic questions that we're asking and the dynamics of the system of care have changed and evolved. So for one, the system of care was built on an assumption that the sites of care were in line with a relative level of acuity. Well, that has changed dramatically. We've seen levels of acuity shift so much to where it's not necessarily concentrated at one site of care or another. So we need to recognize that in thinking about the entire care continuum. The other thing that has changed so dramatically, and even more so this year, is the interplay of all the different factors within the broader healthcare system and the interplay of those trends across the care continuum. That's something that many health systems are grappling with and calling us to create a more dynamic model for the purposes of working with organizations to help them identify opportunities and how to think about their portfolio of services. And then finally, it was an underlying theme within the Executive Summit, the fact that rapid adoption of virtual health has not just been a site or taking place in one site of care, it's across all sites of care. Virtual health or digital health has changed dramatically how we care for patients. And it's not just about the sites and services anymore. It's about the interplay across those and how do we create the best system of care for those patients. So what we're seeing and what we're proposing is a lot more of a dynamic system of care diagram. We're still working through it, but we wanted to propose these ideas to our members at the Executive Summit. And it did have a lot of success in folks saying, oh, that helps me ask the questions that it's time to ask. Things like service distribution, the right partnerships, the ability to have that seamless care across services, no matter the location. Those are the types of questions we've got to ask today. And this is the type of model that can help us do that.
Absolutely. Something else that I noticed when we were talking to, many of our panelists, and then when we were even thinking about the system of care, is that a lot of it seemed to move into the home. That seemed to be a new focus this year.
I think it was Kaiser who said something along the lines of, if something can be done in the home, it should. And that's increasingly an idea that many health systems are putting forward and payers are getting behind. So we are seeing that shift to the home. One of the core components of a presentation that we did on ambulatory strategy is the emergency department, the ED, the ER, whatever you're thinking about in terms of the emergency department. We need to change the way we think about that. It should not be a site of care. It should be a level of care. And there's new models like some within CMS and others that are allowing for more flexible care to be provided in the home, whether it's that hospital at home model or the E3 model, allowing us to put forward different types of care models to care for patients in the place that is most appropriate for them.
Yeah, I like the way a panelist talked about it yesterday. I think they said we've kind of been in healthcare our whole careers trying to make some big changes. And yeah, the last few months have been extremely challenging, but we now have an opportunity to make some changes quickly that we've been thinking about and working on for a long time. So it was exciting for me to hear that kind of hopeful spin that they had, and everyone was kind of nodding along to that. So that was pretty exciting to me.
Trevor, I loved that quote as well. I think they said it took them 3 decades in a pandemic to get something on the table. And I think that was, it was very pertinent. One of the areas, the tough questions that have been really hard for our health systems to do in the past, things like service distribution and being able to have the right location of care, potential consolidation of services. We're getting a lot more calls from our members about this. They're seeing that the time is right now to make some of those bold decisions that will help them in differentiation, will help them achieve some of the goals that they need to achieve and meet the financial needs that they have. So the tough questions that we may have avoided in the past, we're now ready to tackle them within health systems.
I guess we don't really have a choice, right?
I think that's exactly where we're at.
Yeah. And it sets up, if I was on a strategic planning team at a hospital right now, I would feel both extremely excited, but probably have pretty bad heartburn because the processes, structures, and systems I had wouldn't necessarily be set up to really quickly plan for and test a bunch of new opportunities. And I think one of the consistent pieces of feedback we've heard from strategy leaders is the institutional desire to somehow maintain the ability to make rapid decisions that they didn't even know they could do, but that they had to do in the last couple of months. So how can strategy teams change how they work and be even more relevant in this environment?
Trevor, you hit on a topic that I am so passionate about. We teach a couple of courses on this topic as well, but the idea of nimble execution, rapid cycle planning, agility in planning, these are all terms that are used that basically mean we need to focus and move fast. And that's where health systems are. That's where the strategy teams are as they're looking to the future. There are several things that health system strategy leaders are going to need to adopt to be successful in this new environment. One is scenario planning. So with scenario planning, they need to be planning not just for multiple futures, but on multiple time horizons. This is something that while it was true in the past that health systems and strategy teams were looking at scenarios, now that's going to be core to everything they do. Understanding and being able to plan for the potential future states and how they can get there. So that's one aspect of strategy that is changing. Another is that need to be nimble in execution and be able to move quickly. Kathy Cox, who was on our panel as well, and she's at Texas Health Resources, she talked about how they have radically changed their planning process. They are now down to only 6 goals that they are looking to accomplish within the next 90 days. That's a big difference from health systems who are looking at 20 different goals that we're trying to accomplish over the next 3 to 5 years. They're drilling down to what can we take action on now? How do we move forward quickly? And when we talk about this, when we do nimble planning and we teach a course on this topic, we talk a lot about piloting and pivoting. What are the assumptions that we're building into this? And how do we test this? This works really well in the health system where we're used to the idea of hypothesis-based planning. So what do we believe to be true? And how do we test that? So that's something we think a lot about, and our health systems are moving forward with that more quickly as they're using scenarios and planning on these different time horizons. So I was talking with an organization just the other day who was saying, really what we're looking at is we're looking at rolling budgets. We're looking at things like what's happening within the next 2 months, not within the next 3 years. We still have to keep our eye on the vision. That's incredibly important, or else we lose sight and we won't be making progress, but we are taking action more quickly. And it's the strategy team's it's the strategy team's responsibility to be able to lead that.
Yeah. And one follow-on to that, it seems like not only are strategy teams feeling the need to pilot and then pivot, but also execute and get to scale much more quickly than they ever had before and actually be involved in that process. Is that something that you're hearing a little bit more of?
For sure. But the role of strategy, even over the past 5 years, has been increasingly tied to execution. There's some great quotes out there, and I'll butcher them, but basically the strategy without execution just doesn't work. And execution without strategy goes nowhere. So those have to be interrelated, but it's something we have seen in the past. And what we expect to see is even more so as we move quickly, the strategy team is going to be more involved in making sure these things happen and moving quickly, and then also setting up the way that it can be scaled. Trevor, what have you seen in your research?
Yeah, that's right. And it's expanding the competencies that the strategy team is going to need to get that all done, right? It's more on the front end in terms of a variety of different tools to evaluate strategies, and then new data streams and new processes to monitor them on the back end. So it's changing the work that the strategy team has to do, and it's changing the tools and the data that they're going to need to do it. So we can talk about these, you're going to move to rapid cycle planning, but it's an enormous shift in the everyday work and in the competencies that the strategy team is going to need.
And Trevor, I think this is a really exciting time for strategy within health systems. This is a time that maybe they have seen some of their plans in the past languish, and now they're going to be able to take action quickly. They need to be focused on the things that will truly differentiate them, and not necessarily as bogged down on areas that need to happen, but may not help them achieve that strategic differentiation factor. So this is going to be an exciting time for health systems. I think it's going to be a really fun time for strategy leaders in that they will be able to set themselves apart, have a bigger seat at the table, and push their organizations forward. We've seen more progress in the last several months than we've seen in years at many organizations. And to keep that momentum, that's going to be the goal of our strategy leaders. And I think that's really exciting.
Definitely. I think that's a really positive, fun note to end on today. Rebecca, thanks for sharing just the highlights. I mean, this was days and days of content that you've managed to package into a quick set of highlights. So thank you for doing that very well. Of course, thanks as always to our listeners. Please subscribe or follow Sg2 Perspectives if you want to hear more. I always recommend another Vizient podcast, The Modern Practice. It's on Vizient's Medical Leadership channel and provides a clinical perspective into current issues affecting healthcare today. This has been another great episode of Sg2 Perspectives, where industry experts and Sg2 thought leaders explore the drivers of tomorrow's healthcare strategies to inform today's decision makers. Contact us anytime by sending an email to sg2perspectives@sg2.com. We'd love to hear from you. Sg2 revolutionized healthcare demand forecasting with the Impact of Change forecast, and today we're the industry's premier strategy advisory firm. To learn more, visit sg2.com. Thanks so much for listening, and we'll see you again soon.